The Cure Alzheimer's Fund is a group that is going to be 10 years old in October. And every dollar that is given goes completely to research. And right now they are sponsoring projects with Harvard doctors and Mass General, for example, on anesthesia and dementia or Alzheimer's, and the Genome Project. What do you know or do you hear through the pipeline is coming in research? Because they did have that big symposium at the Heinz Center last June with all the Alzheimer's doctors from all over the world coming in, and they said there was nothing out there. But that doesn't give us hope. We need hope, Scott.
I agree, and I do not know of anything. In fact, kind of in preparation,
like how to prevent it.
Well, there really is no way to prevent it. There are some hypotheses or some theories of ways that you can lower your risk, because they know that head trauma is associated with higher incidence of dementia and Alzheimer's. So, if you have a concussion, you need to be careful and rest your brain. You don't want to get another concussion, because repeated concussions, they think, make you more susceptible to developing Alzheimer's later in life, or even what they call early onset Alzheimer's. The other way that may help with prevention is to basically follow what we would call a heart-healthy diet. A heart-healthy diet is designed to maintain optimal circulation to the blood vessels around your heart, so your heart can be nourished by oxygen-rich blood. A significant number or percentage of dementias in this country are actually what we call vascular dementia. It's related to poor circulation to the brain, because the brain is very, very sensitive to a lack of oxygen, to a lack of good blood supply. And they think that following a heart-healthy diet not only helps the blood vessels that supply your heart, but it helps the blood vessels that supply your brain. So that's another way that you can lessen the risk. But they really don't have much beyond that at this point. And there really isn't a lot in the pipeline at this point in terms of addressing the disease. There are some medications out there, but the medications only work for about 50% of the people. And basically all they do, in the best case, is slow the progression of symptoms for 6 to 12 months. But it doesn't reverse the disease or in any other way, kind of mitigate it.
And some of the medications have a side effect of confusion, which for an Alzheimer's patient is just not good.
Yeah.
But you bring up another important point. This is an older person's disease, except younger people are getting it in their 50s. Should we have so little research money out there? Should the money be spent on an old person's disease, or should this just be one of the ways in which we end our life? We die. Shouldn't a child who is suffering from leukemia have the research dollars put on him or her? Should we spend those dollars on old people? Now, I can say that because I'm 75. So I can say that. So answer that question for me.
Well, that's kind of a slippery slope, because what you're talking about is, to me, is kind of like, we're rationing care. We're kind of deciding who we're going to give it to, and in a way, that's almost like we're playing God. I mean, what I would like to see is that we supply or we try to help the child, and we try to help that older person. Because remember, again, when we talk about Alzheimer's, we're not just talking about maybe an 80-year-old man who's suffering. We're talking about his 55-year-old child who is trying to take care of him, and his 14-year-old granddaughter who also lives with him, and they're all affected. So when we talk about Alzheimer's, we say yes, they're older, but what's happening to them is affecting other people. And if somehow we can come up with treatments or drugs that would mitigate at least the symptoms of the disease, that would not only benefit the person, it would benefit many other people as well.
You might be dealing with a 55-year-old who is starting Alzheimer's, although they're saying that the gene, even if you have it, you have a 50% chance of not getting it. Because they're saying exercise, diet, and using your brain. So my husband did all three.
Right.
And his was from a knee replacement when his heart stopped in the operation.
Hmm.
All the doctors have said that.
See, my understanding is that doing keeping your brain active can actually help to delay the onset
Yes.
of Alzheimer's. But there's kind of there's an anecdotal school of thought out there that says it delays the onset, but then once it starts, it progresses more quickly.